Good morning. We're here today with Angela DeRosa from Arizona.
Yes, sir.
And whereabouts?
Scottsdale, Arizona.
Scottsdale,
the world's
Arizona.
most livable place in the United States.
It is wonderful. I was there recently, which had a really nice time.
Yeah, it's awesome for golf if you love that.
It is. Mm-hmm. So let's talk about the focus of your practice. Mm-hmm. It's hormones, age management.
Absolutely. Well, I don't like to say age management. I like to say restorative optimal medicine.
Ah, there we go.
Yeah,
I like that term.
Yeah. So it's really a great practice. I have a couple nurse practitioners that work for me and work with me, and we largely focus on hormonal therapies for both men and women. Although we specialize in women, we find comedic relief in the guys, so we bring them on.
Isn't that the truth? Because men, we all lie, so there's always good stories behind the lies, right? And there's always a good story as to why we're there to get treatment.
Yeah. Well, no, it's actually true. The women drag them in. They don't come willingly, of course. I always tell this joke, and you can use this in future material if you'd like, but I think there's only 3 ways to get a man to a doctor. It's either in an ambulance, with erectile dysfunction, or their wives drag them in. So.
Yeah, there's a lot of truth there.
Yeah.
Yeah. So the focus of your practice with respect to hormones, you like to utilize pellets as a delivery system for hormones.
So when I look at the overall category, I mean, you need to know, as we know, the whole breadth of the data and all of the different modalities, because not everything's going to work for all patients. But I kind of equate pellets to color TV versus black and white when you're using other modalities. It just works so much better, and in particular in women. I mean, the men, they have the injectables, which work really, really quite great for them, and then the pellets kind of add that little something extra. But for women, it is really diametrically opposed, where troches, fast bursts, the creams, all those other options just don't even come close to what delivery I can get with efficacy and symptom relief and overall physiologic restabilization with pellets. So I love pellets, and myself personally, having gone through menopause at 35, and why I really got into this field, I did more harm to myself with everything I could, experimenting and learning throughout the years. But really, pellets saved my life. So when I talk to patients about it, I can be very passionate about it and explain the difference to them.
Yes. It's good to have in your armamentarium multiple modalities for a delivery system. And I've always said that any doctor can make any delivery system work. And it's good to have those options, whether it be injectable, cream, patch, pellet, capsule. Having multiple delivery methods, you can really tailor the treatment to the patient, what's best suits them.
And as I alluded to, not every patient is going to want pellets or can afford pellets, or there may be some guys, for instance, if they're very athletic, they're not going to be good candidates for pellets. I mean, I call it the no acid all syndrome. They just don't have anything to work with.
Right, there's not a lot of room to put anything.
Exactly.
And have you found over the years that, and what I have found, but maybe what you found, almost all men come in thinking it's going to be a shot for a delivery system.
Yes, and I think the men actually want the shots, even though I always say men are kind of big babies, because you put a needle in front of them, they pass out, and the bigger you are, the harder they fall. But I think generally speaking, a lot of the guys are expecting shots, and then you kind of explain that pellets may be a good option for them. And with the men, I'm happy going in either direction. But for the women, I really try to kind of push them down the path of the pellets, because I think guys are easier to work with in the way that they have more realistic expectations of what they're going to get from their therapies, where women, they have very high expectations from their therapies, and I want to be able to meet their needs and give them what they're expecting, but I know I can't do that with most of the other delivery mechanisms other than the pellets. So I kind of equate it with the women. Creams, I may get about a 20-25% improvement of your symptoms. We move into the troches or fast bursts, I may get close to 40-50%, but with pellets I can be 80-100% nailing it for them. So if the patients understand that and choose another modality other than the pellets, then I have to remind them this is the expectation of what you're going to get with those. And as you said, we can do the best we can with those modalities and get the best treatment for them with them, but there are limitations.
Limitations to all delivery systems.
Of course.
Speaking of which, what would be the major pros to pellet therapy?
Well, the obvious, it's kind of like Ronco chicken, set it and forget it. You put them in, you don't have to think about it. The patients are good, usually 3 to 4 months for women, 4 to 5 months for men. So compliance is obviously very, very high. I love the fact that I can get a very even steady state in a therapeutic range with pellets, where with the other modalities, you're gonna have typical ups and downs with the levels going either super physiologic or infra. And so I love the fact that I can obtain that even steady state, which allows the receptors to upregulate and let the body start to heal physiologically. It's also symptom relief. I mean, you get exceptional relief of testosterone delivery, or testosterone deficiency symptoms, estradiol deficiency symptoms. It's amazing. It works great. So.
On the flip side of that coin, what would be some of the cons that you see?
Well, I think the majority may be a little bit more expensive than some of the other modalities, but I often try to put the expectation a little bit more realistic for patients, because they think, okay, they hear maybe $300-400 an insertion, but that's maybe once you get to a steady state 3 times a year, and which for most people they can afford $900-1,000 a year. But they often hear that lump sum, but I say when you annualize it over the others, it's maybe $600 versus $900. And is that additional delta of $300 worth it to get that additional benefit? And for most people, when you put it that way, they kind of go, yeah, I can give up my nails maybe once a month to go do that.
Also found if you say, what's it going to cost you if you do nothing?
Exactly.
What's the indecisiveness or the lack of decision here by not being proactive with
right, and feeling horrible. I mean, they come in and they have all these they go through a list of symptoms and they feel terrible, but I'm like, I'm giving you the opportunity to fix all that. Are you going to take it or not? And so most patients go down that path. And other cons, obviously, it's a small little procedure. They have to come in. Some women want that control of what they're doing every day, and I take that away from them to some degree by doing the procedure and having to do that. So I think those are really the biggest drawbacks, are either cost or that control factor that the patients don't necessarily like in some instances.
How about cosmetically? Do you find any issues with women who may be a little bit thinner and they want to wear the little string bikini and hide in the surgical incision?
Well, everyone they say this is a procedure. They think we're putting this mammoth scar on their tuchus, and we're really not. It's teeny, teeny, tiny. And for most women with the healing, you don't even see the scars. But if you get that somewhat neurotic patient who wants to come in, oftentimes it's okay. If you allow me one little nick, little scar, I will continue to put the pellets in that same spot as to not create other ones. But for most people, it's cosmetically invisible. And so unless you have someone who may be keloid or those types of things. But again, it's a trade-off. What do you want? Do you want to deal with little maybe teeny, teeny scars that you can barely even see other than under a microscope? Or do you want to feel better? So we can work through that with patients most often. But occasionally you'll get those folks that there's nothing that's going to satisfy them. So.
There's always those difficult individuals that are challenged to be able to deliver medical care too. So what else have you found with pellet therapy you'd like to share with us?
Well, I think when I talk to other clinicians and train them, I really, as I said, it's really a difference of just magnitudes of 10, 100, 1,000-fold of difference of what you can do for patients. And with creams, gels, and all those things, I think you can get good, decent symptom relief. But as an internist, I'm not just looking at this as symptom control. I'm looking at this as restoring normal physiology. I want to correct what's lost that Mother Nature took away from us. So it's not just about hot flashes. It's about controlling the insulin resistance, getting the lipid profile under control, preventing that cardiovascular disease and bone loss and all those things that are problematic from a chronic disease state prevention. And with pellets, I can achieve that. So if I have that even steady state, I can correct insulin resistance. As you know, testosterone causes insulin resistance in patients. Oftentimes they come in with hemoglobin A1Cs of 5.9, 6, but with 1 month of pellet therapy, we can normalize that. And that's powerful, and you can't do that with any of the other modalities.
It's very powerful.
Yeah. So.
And when I tell patients that I see, I'm like, we're gonna shift your hemoglobin A1C. Yeah. And like, oh, I'm already taking the diabetic medication.
Let's get you off of them.
I'm like, well, we're gonna get you off of those because this is actually gonna work. So, it was really a pleasure to speak with you today about pellet therapy and its advantages, the small disadvantages, and have a wonderful time here at the
I'm having
AMMG.
An awesome time.
Yeah,
so thanks for having me.